The video you're about to see is an actual event that happened to one of our patients, and we see it quite frequently in our practice, where this patient's teeth were, his lower central incisors were knocked out in a baseball accident. And what we're trying to get across today in this video is that time really is of the essence. We have a short window of time where we can actually reimplant these teeth, and the quicker I get them in the mouth, the better I can reestablish the blood supply, the better the prognosis is to save these teeth, and the better likelihood we have of actually not even getting root canals done. So it's very important that we get these teeth in the mouth very quickly. Patient was hit 2 hours ago?
Probably 1 hour exactly.
1 hour ago, 7:15 with baseball, knocking out lower 2 anterior teeth. Tooth numbers, open, 24 and 25. The patient has been numbed with 2 carpules of epinephrine with lidocaine, and we are about to reinsert the teeth into the socket. Okay, we've just placed the teeth, the avulsed teeth, back into the socket. I've applied the pressure. They're seated against the bone. All incisal edges are lined up. Roots look good. We're going to now bond and splint these teeth together. Brackets have now been placed. We're going to reposition the teeth a little bit before I set everything. Get as close as you can get it. Okay, we got these teeth in, long axis, everything looks good. Now we're going to splint it together with the wire. Okay, teeth are splinted together with an 017 Sentinel, bonded 2 to 2. Open. Can you get the lingual back here? We've got some tissue, denuded tissue on the lingual surface. The lingual frenum looks like it's okay. A lot of tissue, so we'll watch that area. No stitches. This is post-op 1 week ago from Tuesday night, 7 o'clock? About 7 o'clock. It is Tuesday, April 30th, about 4 o'clock, and you can see the tissue is coming back. The teeth have been splinted together, and there is no mobility. Let's get around and get the lingual side. Open. The tissue is still fairly swollen on the lower lingual side of the anterior teeth. Probably in about a month to 6 weeks, we'll get in there and clean that up with the laser. Just kind of waiting for more of that tissue to form. Took an x-ray. The apices seem to be okay. At this point, the prognosis is guarded, but everything looks okay. The only thing we did today was we built up the back of the teeth to make sure that the patient is not occluding on these anterior teeth. So when you have these teeth knocked out of your mouth, one of the important things that a parent needs to ask the dentist is, how many teeth have you actually reimplanted in the mouth? This process, there's a lot of trauma that's happened to the body. You want to have somebody that's experienced, quote, a good pinch hitter, somebody that has a lot of experience reimplanting these teeth. There's a certain knowledge level of the anatomy, the dental bite, how these teeth should be repositioned, and the angulation. Because unfortunately, you only have a small amount of time to position these teeth back into the mouth. And once you position them, where you put them is where they're going to be. One of the things we provide our patients is an emergency kit. And in that kit is actually a special solution that we have that will allow you to preserve the tooth. So when you get to the office, we can reimplant it and we don't have to worry about that tooth drying out. We make it available to schools, to coaches, to organizations, and all our patients. And if you're interested in that, please contact our office and we can gladly set you up with that emergency kit. You never really know which tooth is going to die and which tooth is going to be saved. So I would err on the side of, if it's going to need a root canal, it's going to need a root canal eventually. But if you can put these teeth in the mouth quickly, a lot of my patients, I have documentation to back this up, none of them to date have needed root canals, and I've got cases going back 20 years. If it were my son or daughter and the tooth were knocked out and we could simply put that tooth back in the mouth without a root canal,
you have nothing to lose, because guess what? If the tooth dies, you're going to have to do a root canal anyways. So that's kind of the philosophy that we use in our practice.